Internationally, there's about 5 to 7.2% prevalence of ADHD in youth. And astoundingly, this prevalence is kind of similar in adults too, where it's 2.5 to 6 to 7% in adults. Is that something, does that sound appropriate to you? Does that sound a real incidence?
ADHD, what the common people think about hyperactivity, impulsivity, someone is having difficulty sitting still, someone is fighting, having a lot of anger outbursts. So ADHD has three presentations. One is called inattentive type, second is hyperactive, and third is combined. So children who struggle with the hyperactivity, impulsivity, they are very easily recognized because the teachers complain about it, parents are embarrassed what they are doing.
ADHD is not something that that you could recognize or treat or diagnose by just doing like running a blood test or doing some sort of imaging. It's a clinical diagnosis, and that makes it so much harder for people to recognize, to diagnose, and then eventually treat it.
I agree. And one thing I also want to highlight, I strongly believe is not the ignorance from the parents. Even in my practice, I have seen even psychiatrists, even child psychiatrists, even seasoned psychiatrists have been missing this. Because most of the time, especially in teenagers or even young adults, they come with depression.
Hi, this is Amina from New Wave Global. And today I have a very renowned child, adolescent, and infant psychiatrist with me, Dr. Mohammed Zeshan. Assalamu alaikum, Dr. Zeshan.
Hey, walaikum salam. Thank you for having me.
Of course, it's always a pleasure having you. I keep bothering you for our different mental health issues. Dr. Zeshan is also very socially and media active in media, promoting mental health awareness. And he's also faculty at Rutgers University and also holds very important positions in several psychiatric societies nationally and internationally. So thank you for giving us the time, Dr. Zeshan. I'm going to jump in and talk about the problem that we are going to be discussing today. It's actually a very common neurodevelopmental or neuropsychiatric disorder, which is a lot of times missed, underdiagnosed, undertreated. Although everyone hears about it, but sometimes we're unable to recognize the signs of it and treat it appropriately and adequately and in a timely fashion. So I'm talking about ADHD, attention deficit hyperactivity disorder. And over the years, it seems like its incidence has been increasing. So we'll be discussing with Dr. Zeshan if that's an actual rise in the incidence of the disease, or we're just seeing it more often, or we're just diagnosing it more often as we become more and more aware of it. So I did a little research, Dr. Zeshan. It seems like that internationally, there's about 5 to 7.2% prevalence of ADHD in youth. And astoundingly, this prevalence is kind of similar in adults too, where it's 2.5 to 6 to 7% in adults. Is that something, does that sound appropriate to you? Does that sound a real incidence?
Yeah, I will not be surprised that that is underreported, but that sounds accurate.
Okay, and also it's considered to be a diagnosis of, or the common understanding is that it is mostly a childhood disorder, but the numbers that I just reported kind of negate that finding and or understanding or common perception, and it appears that it's very prevalent in adults too. What is your understanding of that?
No, I think that's a very genuine question, and I really appreciate you and your channel for increasing awareness about the mental health in general and about ADHD. I think what I have been seeing both in my clinic practice and also in my teaching, that ADHD, what the common people think about hyperactivity, impulsivity, someone is having difficulty sitting still, someone is fighting, having a lot of anger outbursts. So ADHD has three presentations. One is called inattentive type, second is hyperactive, and third is combined. So children who struggle with the hyperactivity, impulsivity, they are very easily recognized because the teachers complain about it, parents are embarrassed what they are doing. But many times what we are seeing as an adult ADHD, which is diagnosed in being adult, is actually started very early in their childhood, mostly the inattentive presentation, where They may have been struggling with paying attention, distracted, losing things, misplacing things, room is messy, but they may have high IQ. They may have a very, you can say, parents are very educated that they have seen this child doing really well academically, but makes careless mistake, doesn't make room, clean, or doesn't, forget do things. So they may have been doing a lot of things for the child. And the academically, and the other myth about ADHD, if someone has ADHD, why they are doing well in school. Both are very different things. It may contribute to the school performance, but kids with ADHD, can excel in so many things as well, because it's not a problem paying attention, it's a regulation of attention. Like, I can share a couple of examples. When I was doing my training at Harvard Boston Children's Hospital, we have a Boston Latin school next to it. It's a very competitive school, especially in girls. The inattentive is more common. So we have now the teenage girls, parents say she has been A+ throughout. No complaint from school, most obedient, most recognized in the school. But now she started in this competitive school away from home, and now they are seeing that she's struggling with keeping things on time, reminding, all those things. And let's talk about, I have a mom who, when she got a second child, then she came to me. She was thinking I have ADHD. And when I explored, she has been struggling with an inattentive type, but, very loving, caring parents, a lot of high IQ. But now when this, as a parent, so much chaos come. And now she has been having difficulty, making things on time, forgetting things. But once you circle back, it's a neurodevelopmental disorder. There are subtle symptoms throughout childhood, but due to many factors, it may not have been recognized. So what we are seeing, as an adult ADHD, most of the time, it could be masked because of their strength, because of the family. And now it is becoming more obvious when they are getting a job, that is very high demanding, when they are living outside the family, when they are having kids, or when they are transitioning into the phase that they are struggling to.
Very interesting, how you say that there are a lot of, the common perception or the common understanding is that the kids who have ADHD mostly have focusing problems, and they're unable to perform at school, and that's when it becomes manifest, or it becomes apparent to teachers, to people, and that's when a lot of people end up seeking help. The other aspect of that is too that they just kind of label the child belligerent or rebellious, and they just refuse to accept that there be more to it, and his outbursts or his inattention or his lack of focus is not just because the child is refusing to do that, but also it's stemming from his inability to focus on things because of this disorder. So I'm sure you run across such patients a lot too.
Yes, I think that's a very good, the way you put it. It's a very interesting, and I kept smiling because so many examples are kept coming in my mind. So remember, I mentioned about ADHD is not a problem paying attention, is a regulation of attention. So what the regulation mean? The child can focus 110%, or even if you allow me to exaggerate, 1,000% focus in things that they are interested in, and that is the reason, you can see why it's so frustrating for parents. They are seeing when the child is playing video game, 1,000% focused. Even one of my mentors say, even a bomb go outside, their focus is so much, they don't know. It's a food time, they don't care. Mom is there, so they can even hyper focus on things that they're interested in, arts, craft. But they may struggle things that are boring, that require more effort, that are tedious, that requires small detail. And that's why they may struggle doing homework, but they are excellent in so many things. And parents may think, and that's where the label come, they are lazy. They are what I call, they are not appreciative. They are spoiled. They are manipulative, because, whenever they want to pay attention, they can. But when they don't want to, they don't. Which is, I really feel for these children. So I always this analogy to the parents, and that many times helps parents to understand. I tell them, let's say if someone has a stroke, and because of that stroke, their right side leg is weak. Okay, so this person cannot move the leg. Okay, so let me just repeat. There is a difference between a can't and a won't.
Yeah.
This person cannot move the leg. You give that person, I will give you $1,000. Please move your leg. I will buy you, the Mercedes, or let's say Tesla now. Maybe the Mercedes is too low now. So I can buy you this. I can do that. And when that person cannot move the leg, you will label it. You're so lazy. You're so spoiled. My father never offered me Tesla. Again, there was no Tesla at that time. Anyway, so my father never did this thing. I am trying so much to help you, and you are so unable. You can see, how it's going, because that person cannot move the leg, and it's causing more shame, it's causing more guilt, it's causing more frustration in that person, because this is a can't territory. And
Yeah.
let me tell you another thing, that person want to move the leg but cannot move the leg. Similarly, kids who struggle with ADHD, some areas are can't territory, things that are boring, that are multi-step commands, that are, lot of things, that requires a lot of efforts. Even if they want to focus, they cannot focus.
So yeah. So you feel for the kids, but then again, a lot of times it's just under recognized, or parents sometimes, when their kids are excelling, or when they have other kids who do not have any similar problems, they just refuse to see the obvious too. I've seen that, in a lot of, like you said, educated and well-to-do families, smart parents, but they're just, decide to ignore the signs. So that's something that we've seen very commonly too. But in parents' defense, this is not something that's very obvious, and our first reflex, knee-jerk, is to say that the kid is not interested, or the kid just doesn't want to put in the effort, because like you said, that he has nothing, he's not wanting for anything, especially in our circles. But also to add a little bit of ambiguity to the whole picture is that ADHD is not something that that you could recognize or treat or diagnose by just doing, like, running a blood test or doing some sort of imaging. It's a clinical diagnosis, and that makes it so much harder for people to recognize, to diagnose, and then eventually treat it.
I agree. And one thing I also want to highlight, I strongly believe is not the ignorance from the parents. Even in my practice, I have seen even psychiatrists, even child psychiatrists, even seasoned psychiatrists have been missing this.
Mm.
And because most of the time, especially in teenagers or even young adults, they come with depression. Let me give you another example. I was seeing this consult. A child came after, he jumped from I believe, third floor window and broke, a couple of legs. So they called us, a psychiatry team, that this is a severe depression. Please come and, start some medication-free depression. So I came, and one thing what I learned with my training is it's important what is happening, but it's also very important why it is happening. What is the story behind it? What is the functioning behind this behavior? But and the other analogy that I give to the students and to the practitioner is that iceberg analogy. So the tip is what is obvious, and unfortunately, when parents bring children to us, they only bring in the tip. And the tip for this child was he jumped from the window and broke legs. And so when I was exploring, so I was getting all the information. Mom was saying, she wanted to get the phone away. And he said, I'm not going to give you. And she said, if you're not going to give me, I will take away all these things. And he said, okay, you don't love me, you don't care me, I don't want to live, I want to jump. Something that he did happen, and he actually jumped out of the window. So you can see the suicidal ideation and attempt is not a diagnostic criteria of ADHD. You can see why people may think this is a depression. But now when I am understanding the story, mom is telling, from very early age, struggling with paying attention, focus, forgetfulness, low grades, frustration tolerance, sitting still. And on that day, he has a lot of impulsivity. And on that day, just out of, he has not been feeling depressed, he was just got angry, and out of anger, he did this. There was no depression there, but it was actually ADHD. So you can see why even a seasoned practitioner struggle to diagnose it. So I cannot even imagine how parents can identify this, because it's not easy, as you mentioned, because we don't have blood tests, we don't have,
Imaging
and imaging, diagnostic imaging. But what I would say to parents, that your child the best. And you have all the skills. If God has given you children, he also give you all the strength, all the potential to raise them. And so you are trying to raise, you are trying to do your best, but because of all those efforts, if the child is struggling, so don't see it as a failure on you or on a child. If despite all those efforts, if you see the child is still struggling, get some professional help.
Yeah. So basically, the gist of the conversation is that if you see something abnormal, don't just think that it's either you or the child, or the child is just being difficult or hard. If it persists, and especially if it persists not in all aspects of his life, then you should probably ask or have some professional help. Yeah, that's a very important point that you made, because we as parents don't or understand or recognize the signs, and not and a lot of times miss the point where help should be sought, and that makes the our lives, and particularly the children's life, very difficult. Also, the other thing that I kind of alluded to it in the beginning too, was, are we seeing an increase in the incidence of ADHD? And if so, why? Or is it just that we have become more cognizant of the disorder, that we're recognizing it more and more, and it has always existed, but we just weren't aware of it and weren't really looking for it?
I think definitely having more awareness, having more, now you can see even a lot of pediatrician, they have, I don't know if they have the child psychiatry rotation yet, but they have a significant curriculum on mental health in their didactics, in their course. And then there is a lot of social media awareness to it. And so I think, and then the child psychiatry programs, and there are a lot of collaborative efforts between mental health and the pediatrician and general practitioner. So I would say the increase, so-called what we are saying, is because we have more awareness to it.
Okay.
We have, just like you can say, just like, in India, Pakistan, when we didn't have angiography there, but people were still struggling with heart attack, but they were dying. But now, and since the angiography came, echocardiography came, we are recognizing more and more, and we know people are coming even earlier because there is more awareness. Similarly with CT scan, you can go with the chest, now. So there are so many reasons. What we are seeing increase is most likely because we did not have that sophisticated training, awareness, and now people are more being recognized. Especially school, there are a lot of training in school that is happening, how they be more aware of it. And many times in my practice, we get consults from school, and that's the child struggle, because that's where the most boredom and all those activities happen. So I think these are a couple of reasons that we are seeing more and more.
Okay, so now if we jump over to the treatment part of ADHD, I see that a lot of physicians are quick to prescribe excuse me, medication excuse me, medications to the kids. I see a lot of children, of people that I know, and also several adults in my practice too, who are on medications. And if you ask them if something else was tried, if any psychiatric help was given, or I see there are even some cognitive behavioral therapies. There's even a feedback loop treatment that's out there, but people haven't even heard of it. And I see almost everyone who carries a diagnosis of ADHD on Adderall or certain other stimulants. So is that what you see in your practice too? And is that the way to go? Or there are several steps before pharmacological therapy is offered to patients that can be tried and are effective?
I think I'm glad you asked that question. So recently, especially in the past year or so, we get so many calls from adults, usually, not the children, but I will go back to that part as well. So we get so many calls from adults that, we have this online website. We did some testing and they diagnosed us with ADHD. And, they were prescribing us this Adderall, but now because of the changes and there were a lot of things that people were not qualified who were just prescribing. but now that online service is gone, can you prescribe? And I am surprised, especially for the 1 year, how many times, that is calls are happening. And when I ask them, can I get some report from the previous clinician? First, there was no clinician actually. This more surprising. Can I get those reports? And when you read those reports, those are pretty basic, based on, as I said, a couple of symptoms, and this is the diagnosis, and you need this medicine. So that trend is unfortunately there, that over prescribing it. I don't know, but there could be many reasons to it, because it has a lot of addictive potential. It has a lot of street value to it. But let's talk about children. Once someone is diagnosed with ADHD, clinically, neuropsychological testing, the best and the most, I would say, the outcome treatment is the medication.
Okay.
So in anxiety and depression, I would suggest my parents to go for therapy first. And if that's, unless it's a very severe kind of anxiety depression where it is affecting significantly, but in a mild anxiety depression, I even suggest to go to therapy first. And if 6 months or a year, if not getting better, then come to me. But when someone has ADHD, then definitely my recommendation based on evidence base and start the medication. But that doesn't mean there are not other treatment modalities there. Let's say, so I have this conversation with the parent. Parents say, I don't want to start the medicine, but that doesn't mean that, there are other options. So what I would suggest is, what do you think you would like to do? So there are what we call executive coaches are there, ADHD coaches, executive coaching are there. There are some therapists who are specialized in, in ADHD, and they help with, help with the self-esteem, help with, setting smaller goals. And so those are and similarly, omega-3 fatty acids, there are some data that helps more with impulsivity and anger, not much with the inattentive piece of it. So I tell them my recommendation will be start the medication, because in psychiatry, ADHD is the diagnosis where we are hoping and expecting and seeing 80 to 90% improvement in symptoms with medication. It's just that effective. And many times parents start all these things, but the best we see is pretty minimal. And I feel sad for those children that they may not achieve the potential because they are not getting the most effective treatment. But there are so many out there.
So it's I think I'd like to highlight it a little bit more. The fact that you mentioned that there is 80 to 90% improvement in people who are diagnosed with ADHD. So that's something that I think we need to highlight and let people know, that the treatments that are out there for ADHD are effective and will help you gain your maximum potential if you are actually treated. So it's not like, a lot of objection I see to medications is, oh, they're not going to help, and the children will just get addicted to this, and, and so forth in that way. So that's a very important point that should be highlighted in this conversation, that the treatments that are out there are actually effective. The other question I had, Dr. Zeshan, is that, so is there, because this is also a very common concerns that parents actually raise, is that, will my child ever be able to get off of the medication? Is there an end to it, or is this a lifelong treatment? Like, if you're diagnosed with hypertension once, more likely than not, you're just going to stick with the medication. So is that the case for ADHD too?
So let me just answer, your comment first, and then I will answer this one as well. So these medications are effective 80 to 90%, but we are not seeing that improvement in the real world, when we see comments on Dr. Google and many things, and I believe on them. And the more I practice, the more I found the reason to believe on them, because due to shortage of child psychiatrists, most of the time these medications are being prescribed. Again, pediatrician, excellent people, but they do not have that intense training to it. So now I have seen children, that very young age, starting at a higher dose to it. or the titration is not as, because we go in a very intense training with that, because ADHD is bread and butter as a child psychiatrist. So we go intense training with the medication management. But the reason these medications are effective, but not effective, that what I'm saying is because most of the times, even as a child psychiatrist, I have seen people, they struggle to titrate the dose, or they may go to the, let's say, start with a higher dose, move so fast, or switch to something really sooner. So these are a couple of things that, we may not see. One thing is commonly happen, and I think that happen, emotional blunting, the change the child who they are. And I have seen children, and the reason was it started very high dose, or, they didn't change, when it was needed. So just to highlight, it's good to start with the pediatrician because they are very accessible. But if you see things are not going well, I think it's important to get the consultation. So to answer your question, that ADHD, sorry, if you can repeat the last comment, I can. So if,
Yeah, I was just asking that, is it like undertreated? And, if it's not, even when people recognize it, just because of, the questions associated with whether it's actually going to be helpful or not. Yeah, is it undertreated?
Yes, and either they need when they grow up or not. Yeah, that's yeah. I think in general, 1/3, especially the hyperactivity and impulsivity symptom gets better over time. They automatically get better. And 1/3 they may grow out of it, depending on what kind of job they get. Remember, it's not a problem paying attention; it's a regulation of attention.
Yeah.
Over time, let's say if they have ADHD, they are taking the medicine, they are achieving their potential. But as you know, when we go in college or when we go in the professional field, we may have the option to choose what is more interested to me. A lot of time the kids with ADHD, they may are more hands-on, or they may find something with the IT, so they may find some jobs that are more in line with them, and they may not need the medicine. Even during their school days, if they don't have a lot of homework during the weekend, they may not need the medicine. I hope that makes sense. So it's when they struggle, and a lot of time people say, oh, but we can wait till they grew out of it. But why you have to wait to go at the end of the tunnel to see the light? Why not you can bring the light when we can, these medication, this treatment can bring light inside to it.
So basically, they can, if they find their niche in life, or if they find the things that they're comfortable with, there is a chance that they would be able to come off of medications, or may not require medications as intensely as they did when the initial diagnosis was made. So, yes. Okay, understood. The other question I have is, and also that we see very commonly, is what's the social impact of ADHD, of untreated ADHD, obviously, where our understanding is that once the treatment is started, the behavior improves, and if it's treated appropriately, there is a tremendous improvement. But untreated ADHD, what's the social impact? How does the society suffer? How do those individuals suffer in general in their life?
I think let's start at a young age. Just imagine, kids is very interruptive, talking out of turn, blurting out things in the class. It may come as a showing off, and having difficulty regulating their emotion, getting upset very easily. So one thing that even young age I have seen, they may not have a lot of friends. They want to make friends, but even the parents, they may say that, may not have play dates with them, or may help their children, it's okay to not hang out with that children. So I have seen a lot of social isolation, even bullying, even labeling those children, even from the teacher, they are, oppositional, defiant, not wanting to do things. So, and that it also affects their self-esteem as well. Let's go in the teenager, substance use, traffic, roadside accident, unprotected involvement in, activities that because of all that impulsive behavior may kick in there. And when you go, even further, jobs, switching from one job to another, saying things, blurting out things to the boss, someone give you a feedback and it's hard for you to control and you just said thing out there. So these are just some clues, in some ways how it can manifest to it.
Okay, so it does have a huge social impact, and it's not like, and it's just not the individual who's affected. It's the entire, it's their entire society that's infected. It's the entire circle which is affected. So again, highlighting the point that it's something that can be easily treated, can help you lead children and adults a normal life. So it's something that should be recognized and treated. Lastly, Dr. Zeshan, I would like you to address the fact that if there is any social stigma associated with the diagnosis, is it one of the reasons why people initially don't seek help, or even once they're diagnosed, they don't make the diagnosis known? Like if people have high blood pressure, they're okay with discussing it with anybody, but is ADHD something that people don't like to discuss or disclose as a diagnosis? And the other, or the the last thing is, what are the signs or symptoms that you would like the parents of children to look out for and then seek help if they see that? I know we discussed it initially too, but I want this to be a take-home message because I think it's extremely important.
I think stigma definitely plays a huge role, and especially in our Desi communities, who don't, because what we have learned growing up, if you are not doing well, parents get more strict, more, punitive, and we have seen those working for us. And those are just part of our DNA. When our kids don't do well, let's get more tutoring, let's get more reward. If that doesn't work, let's get more strict, let's take away all those, the things that they are doing. Yeah, and I think there is nothing wrong to it. Let me be very clear, but remember, if because of all those things, our kid is going away from us, I would highly encourage parents to think about it. Yes, you don't have to share with everyone. Even in school, I have seen so many times, the parents don't want to disclose, because I agree the other kids will say, oh, because of ADHD, you get more time, so when we make some accommodation, oh, you get, because, and oh, yes, you do good because, you get extra time, or you get all this accommodation. So even in school, even teachers sometimes have difficulty to have empathy and kind attitude to it. But, if you as a parent will not think about your child, who is going to think? Just think of that stroke and the person who has paralysis. Yes, there will be so many things if you share with the family, but, that's the reason this person is not going out. But, if we don't make that happen, that person may miss out on so many opportunities just because of we are hiding it. So I can tell you, parents, you have a lot of power inside you. You have a lot of creativity. If you just think that, this is something my child is struggling, I need to help. How can I need to be creative in a way that I will share few that who need to know, and I will not others. And when the times come, it will happen. So that is one thing, but stigma definitely plays a role, and I feel for parents, but I also want parents to feel they are already feeling for their child, but be a good advocate for them, and that will be good role model for your children, that they can be a good advocate for themselves. Sign symptom, as I talk about, inattentive, forgetfulness, problem paying attention, easily get distracted, making careless mistakes even in subjects that they are really good at. Misplacing things, forgetting things, room is very messy. On the other hand, blurting out things, problem sitting still, difficulty, moving around a lot, blurting out, interrupting others. So these are some of the signs of it. But just last thing I will say, just like a chest pain is a sign of heart attack, not a heart attack itself. I don't want after this people listening to it and everyone is self-diagnosing, I have ADHD. These are all symptoms to have it.
And that's your cue to seek professional help.
That's your cue to. Thank you. Yeah.
Yeah. Thank you so much, Dr. Zeshan. I would like to end by bringing your analogy back of it's a problem of can't and not won't. So if your children are struggling, please understand that they probably are struggling because there's something that needs to be understood or diagnosed or treated. It may not be ADHD, it may be another psychiatric disorder, but if you see something abnormal, please seek professional help. And I think that would go a long way with your children, as well as, make your lives easier too. Thank you again, Dr. Zeshan, and I always appreciate your input.
Always a pleasure. Thank you.